Hi, I'm Dr. Dave Chardota. Today we're going to show you a little video and talk to you about amniotic tissue injections, specifically by the Amniox Corporation and their product Clarix Flo. Clarix Flo is a dehydrated, freeze-dried product made from amniotic tissue and umbilical cord. The umbilical cord being the most important part, it makes it separate and distinct compared to other types of companies who make this product. As a patient, when they come in, they have the issues that we want to address with this type of product. Usually it's a tendon injury, could be a complete tear, could be a partial tear, could be a tendinitis or tendinosis. Plantar fasciitis is a common joint issues with inflammation. Pretty much any inflammatory process in the body that affects the foot and ankle. And what we're going to do is when patients fail very conservative care and surgery becomes an option for them, and certainly most patients want to avoid surgery. This would be an excellent adjunct treatment to try and get them to be pain-free, avoid surgery, and in the long-term time off work and the cost of surgical procedures. This is usually the brochure that a patient would get on their first visit with me as a consultation. We would talk to them about what's wrong with them. It might mean getting an MRI, it might mean getting an ultrasound, and then we have them back for a consult. We give them the Clarix Flo brochure, which tells them about the product that's in the bottle. It tells them which treatments are usually used. It tells them the basics of how it helps them help themselves regenerate their own tissue. This is given, patients call, they have questions. Once we answer all the questions for the patient, then we proceed to bring them in for the actual injection procedure. That day is usually about a half hour. We bring them in, we make them comfortable. Some patients can be a little nervous, as anybody can be with an injection. We take the material, we rehydrate it, we let it sit for about 15 minutes. During that time, we converse with the patient, use our ultrasound, make sure we're going to give the injection in the correct spot. At that point, after the 15 minutes, it's dissolved and the crystallines are smaller, they're rehydrated to a higher degree so that the injection is not painful, and then it absorbs actually and you get a better result after the injection. The real concept of this is when you inject this into a damaged site, it draws your own body's healing power to that site, and technically you're healing yourself. You're just doing it at an exponential rate. So today we're going to bring in Beverly. We're going to give her a perineal tendon injection, and you'll see how easy this is, and then the results are fantastic. Good morning, Beverly.
Good morning.
Are you ready for your injection today for
Yes.
the tendon?
Yes.
Great. Let's get that going so we can get you healed up.
Okay.
Follow me. We're going to give an injection of what's called Clarix Flo. This is a human amniotic membrane and umbilical cord. It comes freeze-dried. It's processed sterilely, packaged sterilely. It's put out by the Amniox Corporation. And as we see, we get into the package. It is stored powder form. We are going to reconstitute this with some sterile saline. And so we're going to take 2 cc's of a sterile saline mixture, and then we're going to mix it directly into the bottle. And it's about as simple as it gets to reconstitute it. We let it sit for a few minutes, and then later we're going to be injecting it into a perineal tendon for a partial perineal tendon rupture. So right now what we do is we identify the tendon here. This is the bone. That's your fibula, outside ankle bone. There's the little deficit that you can see right inside of the tendon. It's the more black area. And as I move the tendon, you can see the tendon shift right straight through there. Okay, so you can see that area. This is where we're going to be injecting the amniotic tissue. So the first thing we're going to do is we're going to give a little bit of Novocaine to make this a little bit more pleasant experience for the patient. So a small amount of anesthetic is given, just directly away from where we're going to inject, and that will help because the needle we're going to be using later will be a little larger needle. Okay, there's our deficit again. And as we inject the needle, we'll go directly in our line. You should see the tip of the needle right here. And now you can actually see a little bit of the fluid going into the tendon. And you want to do it along the tendon, a little bit here, and then a little bit along the tendon, all around through the tendon sheath. That's about as simple as it gets. There was painless, Bev? Okay.
Sure.
Painless, and what we will do from now is we're going to clean up the patient. Patient goes into a removable boot for usually 2 weeks, 4 weeks, depending on the type of injury and the degree of damage to the tendon. Then we see the patient back in 2 weeks, and we gauge her over the next 6 to 8 weeks. About 40% of the time, patient will require a second injection, but we'll decide that about 6 weeks out, and hopefully a second injection won't be necessary.